Okay, so this is the instrument that we use in torque release. It is called the integrator and is devised by Dr. J. Holder. Right now it is in neutral position, as you can see, because the dot is lined up in the center line. In order for right torque, we just turn this top piece so that the dot is lined with the right dot. In order for torque in the left direction, we line it up with the left dot and back to the center for neutral. In order to preload the instrument, we just pull back this lever until you hear a click. And in order to deliver the adjustment, we just place the tip on the segmental contact point and just deliver a slight pressure, and that's the adjustment.
Demonstrating how to properly place your patient on the table. First, I want to make sure that they have everything empty out in the front pockets. Next, I'm going to have them lay face down on the table with their legs, both feet hanging off the table, like so. Next, I'm going to check for positioning. So I'm going to make sure the patient is centered. Make sure that his hip is centered. If not, I'm going to move him. And then I'm going to check for his EOP to be centered with the center of the table. And afterwards, I'm going to check to see if there's equal distance apart from both legs relative to the center. And then I'm going to make sure this part of his top part of his shoe is exactly at the edge of this table right here. So, sir, can you please move up a little bit? Keep going, right there. Okay. Now we are ready to elicit a functional leg length reflex.
Okay, so now we're going to go through priority 1. It's important to note before for each adjustment that you can only adjust up to 3 times per session, and after each adjustment you must clear the legs first. So in order to start with priority 1, we must rule out priority 2. In this case, I'm going to do the reflex to determine the short leg. In this case, the patient has a right short leg, so I'm going to have the patient turn to the left and do the reflex. And it's still unbalanced. I'm going to have the patient turn to the right and do the reflex. And it's still unbalanced. So in this case, we can bypass priority 2 and move on to priority 1. You can turn your head neutral. So the first thing we address in priority 1 is lateral occiput. So we're going to go up and we're going to find the EOP, and we're going to palpate along the superior nuchal line to the outermost portion on the short leg side, and we're going to do pressure test medially. I'm going to check the legs, the reflex, it's balanced. It's balanced, then we're going to do pressure test with torque to the right and to the left, and check the legs. If it's balanced, then we're going to deliver the adjustment. In order to deliver the adjustment, I'm going to preload the instrument, place the tip on this contact point, and deliver the adjustment. The next part to adjust would be the sacrum. In order to pressure test for the sacrum, we're going to pressure test lateral to medial, like this, and we're going to check the legs. If it's balanced, then we're going to test each individual sacral tubercle from S2 to S4. So we're going to find S2 and pressure test, S3 and S4, and check the legs each time. If the legs balance for each individual sacral tubercle, we're going to check torque as well. Right and left, each segment, and check the legs to see which balance. And in order to deliver the adjustment, I'm going to come over to this side. I'm going to find the segment that I want to adjust. I'm going to place the integrator from lateral to medial, and I'm going to rock the patient beforehand in the line of direction before I give the adjustment. Okay. So the next thing that we're going to address would be the coccyx. So to pressure test the coccyx, we find the coccyx and we just go I to S. Okay, if it's balanced, then in order to give the adjustment, I'm going to place my thumb at the base of the coccyx, and then I'm going to place the instrument below my thumb in an I to S drive towards the ceiling and give the adjustment. After that adjustment, I'll clear the legs and I'll address the sphenoid. To pressure test the sphenoid, I'm going to go find the patient's eye and go lateral, and then pressure test north, south, west, and east, and check the legs each time. If the legs balance, then we take the legs balance. I'm gonna come around. Patient, can you turn this way? Okay, I'm going to tissue pull in the line of drive in which it's balanced, and then place the integrator on my thumb and give the adjustment. And that's priority 1.
Okay, what I'm going to show you this time is we're going to do position, or priority 2. We're going to start with priority 2. Before we start with priority 2, as we talked about before, we're going to make sure the patient is centered in the table, make sure everything's out of the pocket. Okay? I'm going to start with doing the reflex of the feet, to check for the short leg. And with the patient now, she has a right short leg, so we're going to first check for cervical syndrome. By doing that, I'm going to have the patient turn her head to the left, or the long leg side. I'm going to do the reflex. I'm going to check, as I'm doing the reflex, the legs balance. This means the first thing I'm going to check for is posterior C1. I'm going to apply a pressure, slight pressure, to C1 TP. And come back, reflex over again. Say the legs balance. I'm going to check for torque now. Right or left torque with my finger. Again, going to the TP on the right side, right or left. Check. Say the legs balance, and I know there's torque. Let's say it's C1. If I pressure test C1, I do the reflex, the legs don't balance, I'm going to go down to C2, or C5, excuse me, for cervical syndrome. I'm going to check C5, spinous, I'm going to pressure test, spinous, reflex, legs balance, then I know C5 is what needs to be corrected. And then again, also, I'm going to check for torque, right or left torque, reflex, legs balance, then I know there's torque. The cervical syndrome of turning her head to the left does not balance the leg, then I'm going to have her turn her head to the short leg side, in this instance to the right, reflex test, and then say the leg balance now. This means that there's a wronging, and this is laterality of C1, so the first thing I'm going to do is pressure test lateral to medial, C1 TP, come back, reflex, legs bounce. Then again, I'm going to go check for right or left torque. Each time I'm going to come back, check, balance, legs balance, and then I would set up to correct the lateral C1. So I'm going to set up, I'm going to find the C1 TP. I'll put the instrument, so we're going to be going straight, lateral to medial, and that's what it will look like. Now we're moving on. So if there was not a wrongness test, now we're going to be looking for bilateral cervical syndrome. The bilateral cervical syndrome, when the patient turns their head to the left leg is short. Then when the patient turns their head to the right leg is short. So from there, I'm going to start with checking the occiput, the PI occiput. So I'm going to come find the EOP, slight pressure test, reflex, and if the leg's balanced, we know it's a PI occiput. Then to correct it, you're on the EOP, just inferior aspect of the EOP, and you would do the adjustment. The next test we're going to do is the coccyx sphenoid test. I'm going to do a pressure test for the coccyx first. I'm going to go I to S, reflex, legs balance. So on this, we're not going to be using any torque. It's going to be I to S. I'm going to find the coccyx. It'll be slight anterior to the posterior, so we're going to be pointing this way, and then do the adjustment. Reflex, legs balance. Now we always have to do the sphenoid after we do the coccyx. So I'm going to have you turn your head to the right for me, and the pressure test the sphenoid, we're going to be going north, south, east, or west. And after that, I'll then again find the correct line of drive, reflex, legs balance, and I'll show you. Go ahead, turn your head to the right, and say it's north to south. It'll look like this. And the sphenoid, east to west, and so on. Then after that, we're going to go, so if that does not balance it out, then we're going to go to C5. We're going to pressure test C5, spinous, come back, reflex, legs balance, again, check for right or left torque, and then after that, after C5, we go to C1. Of course, that's if the legs don't balance after the C5 pressure test. We go to C1 pressure test. We're still working on the bilateral cervical syndrome. The reflex, it still doesn't balance. So then after C1, we go to T6. We find T6 spinous process. Then we're going to pressure test. Again, reflex. If it balances, we're going to again right or left torque, correct that. If it doesn't balance, we're going to go back to C1 laterality. Pressure test the TP of C1, reflex, legs balance. I would of course then correct it as I showed earlier, C1 laterality, which is the lateral aspect of the right TP. And there is priority 2.
Okay, I am going to be demonstrating priority 3. And you arrive to priority 3 after you clear the patient of priority 1 and priority 2, or you don't have any positives. Okay. For priority 3, it deals with your pelvis. So your pelvis has 3 components: your sacrum, your ilium, and your greater trochanter. Okay. First, I'm going to check for an AI sacrum. I'm going to pressure test on the ischial tube, pushing I to S towards the ceiling, and imagining that I'm lifting the sacrum up. Then I'm going to do a functional leg length reflex. And if this is positive, in order to adjust this, I will take my instrument, my integrator. I'm going to do a little tissue pull, the ischial tube, and I'm placing the instrument at the ischial tube, trying to point straight up to the ceiling. Okay? Next, I'm going to recheck. If it doesn't balance, I'm going to move on to the second part. The second part is a PI ilium. In order to check for PI ilium, I will find the patient's PSIS on the right, so we're assuming the right leg is short. Now I'm going to pressure test I to S. After that, I'm going to do a functional leg length reflex. And if it's positive, in order to correct that, I would take this instrument, find the PSIS, and place it inferior lateral to the PSIS to deliver the adjustment. Okay. And I'm going to retest or recheck. If it's still short, if it doesn't balance, I'm going to go on to the third component, which is an AS trochanter. So I'm going to find the greater trochanter on the patient, and I'm going to swipe down, pressure test, check the reflex. If it's positive, in order to deliver the adjustment, I'll take the instrument, place it superior to the greater trochanter, and adjust. And after that adjustment, I'll recheck. And if that doesn't balance, I will move on to the last component, which is a superior gray mark. So in order to do this, I will place both hands. You can place both hands or one hand between the patient's leg and have the patient squeeze them together, squeeze his or her legs together. Okay. Now for this, it's an opposite effect. So you should have the leg become shorter. Okay. So the leg does become shorter. I will have the patient flip over to confirm. I would have the patient put his hand at his belly button and put a triangle, and on the right side, try to find that really tender part, that bone, which is your superior pubic rim. In order to pressure test this, I'm just going to swipe down, S to I, and you can actually do a functional leg length reflex supine. So you just recheck, and if it balances, I will deliver the adjustment. So in order to deliver the adjustment, I will find the superior pubic rami, and I will have the instrument straight, S to I. Okay? It is important to know that this priority does not include any